Welcome back to Real Health. If you just tuned in, you come to the end, tuned into the end of the show, but don't worry, there's still so much valuable information left for you. Polycystic ovarian syndrome is one of the most common endocrine disorders that affects many women, and in fact of reproductive age, and it can lead to numerous complications, including metabolic dysfunction and infertility. And we have a request from some of our viewers to discuss it on the show. In fact, since the first season, our viewers have been asking to discuss it. So today we've brought in our favorite homeopathic doctor, Dr. Prenitha Naidoo. I just said to you now off air, it's crazy how many women that I hear that either have not been diagnosed and they've either self-diagnosed, they've researched it and they say, I think I've got PCOS, or we're starting to see that more women are being diagnosed with polycystic ovarian syndrome.
100%, because they say that generally it is diagnosed during the childbearing years, so often young ladies start much earlier.
Yeah.
So it normally hits you between like the ages of 18 and 44. So when you actually trying to fall pregnant and you see that infertility, you've been trying for over a year or 12 months and you can't fall pregnant, then they start looking into PCOS. But sometimes it actually happens much younger, where this disrupted period.
Yeah.
So you get your menarche and your period starts, and then you notice initially you don't get your period every month, and then it's every 2 to 3 months, and then it's not, the cycle is not how it used to be. So 28 day, 32 day, all over the place. But often that is the first sign, and most doctors will say that's normal, you know, your period is starting, your body's trying to balance itself.
Yeah.
And then we get the other symptoms that follow then the unexplained weight gain. So you get the young girl saying, I've come in, you know, my period's all over the place, and now I've started gaining weight, and there's no real reason for the weight gain. It's not that I've changed my eating habits or exercise. So those are two of the main symptoms that you most women experience. And the other thing is they don't know whether insulin resistance causes PCOS, the polycystic, or vice versa. So they can't tell which one comes first, okay?
But we definitely know that insulin function or functioning is related to PCOS.
Yes.
Yeah.
So let's break it down and make it simple so people can understand what's happening. So in a female body, we're governed by 3 hormones, main hormones that we know of, your progesterone, your estrogen, and your testosterone, to a lesser degree, because testosterone, as we know, are male hormones.
Yeah.
So often what happens is when you get a period, you are ovulating. So you are releasing a mature egg that can be fertilized by a sperm. That's generally what happens, and that's when you get your period or how you fall pregnant. So what happens is you have a specific hormone called FSH, which is your follicle stimulating hormone.
Yeah.
This hormone in the ovary actually gets you to release the little follicle. And that's the follicle that now prepares to be matured and be released. Then you get something called your luteinizing hormone, or your LH hormone, which comes in, and that allows that follicle to mature and for you to let it go. So what happens in women that have PCOS is that they have all these follicles that are sitting there. So they've got the follicle stimulating hormone, but because of the androgen, meaning more male hormone than female hormone, these follicles do not reach maturity. So they sit as these little cysts within the ovaries.
Okay.
So now if you think about it, if you don't have a mature egg to be released, you won't get your period. Okay, it's not going to stimulate any of that happening. So that's where you get the disrupted period.
Okay.
And that's where the male hormones are kicking in. And then the symptoms that most women will experience is they'll say, I'll get hair, like, and we call it hirsutism in medicine, where they get unexplained hair on their chin area. They notice acne breakouts, way persisting over the teenage years. So they see acne on their chest and on their back. And the big thing with the PCOS and the insulin resistant part is why insulin resistant is so predominant in the syndrome is because insulin plays a big role on testosterone. So when you've got high levels of insulin, your body's releasing more of that androgenic hormone. The other symptoms that most women will complain about is they'll feel depressed, and that definitely goes with it, right? You're going to feel sad, you're going to feel down, your hormones are not balancing as well as it should, right? And you see that female showing more male traits than female traits. So they get angry much easier. You know, the female hormones are what makes us a little bit softer, but you know, the testosterone makes us a little bit harder. Now when you're too abrupt and too stern, then you gotta think, is there a balance within my hormones?
And how do, if there are some women that are watching and saying, okay, some of these things maybe are ringing a bell.
Yes.
Maybe I've never noticed if my period has been irregular.
Yes.
How do we test for it?
So the first place to go is, if you think that this is possibly what you have blood tests checking your progesterone, your estrogen, your testosterone, DHEA. As we know, DHEA is your mother hormone. We also know that what governs most of female conditions is stress. Most women are under immense stress in the working industry.
Multifaceted stress,
100%, and that's also an onset of inflammation. So look at your cortisol, look at your endocrine system as a whole. Test for insulin resistance and see, is this probably the reason why I'm putting on unexplained weight, why I'm not getting my period.
How do we start with diet and helping to improve symptoms and the condition overall?
So often with patients that come and see me, I often tell them a whole food diet is the way to go, right? We want to reduce that refined carbohydrates in our diet. We want to reduce the sugars in the diet. We know the carbs convert sugar in your bloodstream, feeding into the syndrome. So what we want to do is whole foods, vegetables. Protein is so important, right? And having a balance between your protein and your vegetables, and that's also a debatable topic to talk about, is because protein, so many of our animals are pumped with hormones, and now you're getting extra xenoestrogens from everything else. So you've got to sort of look in your environment and say, how do I do this without putting in extra hormones into my body? So definitely a balanced diet. I mean, exercise is very important. Most women that do come and see me with PCOS say, I do exercise and I still don't lose the weight. And it's not just based on the exercise, it's based on that full sort of introspective look of what do we do holistically to help your body.
And also de-stressing. You're exercising first and foremost to de-stress in that situation, not 100%. Necessarily lose weight. And are there any other supplements that they can be taking? Okay.
Yeah, so definitely if you're showing up with insulin resistance, things like chromium are amazing, right? Cinnamon is great with balancing and regulating that blood sugar. Inositol, there's a specific form of inositol called D-chiroinositol. I get great results on that on lowering insulin resistance, so I find that really beneficial. Things like evening primrose oil helps to balance hormones. Agnus castus or chaste tree berry, a hormone balancer, and the key is that you need a practitioner to guide you, right? Someone to guide you and tell you this is how much you need to take of everything.
So bilberry as well.
Bilberry, amazing. Maca is a superfood. Adaptogen goes in, balances cortisol and balances hormones as well. So there's many things, omega-3s, curcumin, turmeric extract, all of those kind of things.
Fantastic. So in other words, just go and find Prenitha. She'll help you out.